Coronavirus cases here in Maryland and across the country continue to spike, with even more cases expected as we head further into the winter months. But a coronavirus vaccine could be made available within just the next few weeks. And joining us more to break it all down is immunologist from Loyola University, Dr. Chris Thompson. Good morning. Thanks so much for joining us.
Good morning. Thanks for having me.
So we continue to see the rise in cases, and they were talking about the Thanksgiving holiday. Really, we don't know what those numbers are going to be. So what do you see as we head into the winter?
Well, we're starting to see those numbers now. So most people see signs and symptoms start to emerge after 4 days of exposure. We're in that window where things are getting worse. And it's not surprising we're seeing hospitalization rates going up more and more. Now, by 11 days or so, 97.5% of people have shown signs and symptoms. So I expect these numbers are going to keep going up, unfortunately. And if we don't change our plans for Christmas, it's going to be bad.
That's pretty dire. I know that's what a lot of the experts have been talking about. And the hope that's on the horizon is this vaccine that could be made available. We know from the governor we're about to get 155,000 doses. He's saying that's really only going to cover about half of the healthcare workers. So what are you expecting with this rollout of the vaccine?
Yeah, so I think the governor articulated it very well, and we need to vaccinate the people in nursing homes, the most vulnerable population, and we need to vaccinate frontline workers as quickly as possible. But remember, this is a 2-dose vaccine. So if we get 155,000 doses, I don't know if that's going to cover only 75,000 people or if that counts for 2 doses for each. But we're not going to get the general public vaccinated probably until March or April at best.
And what advice are you giving to people who might be hesitant to take the vaccine? Because that's really the thing here. Not everyone is going to take the vaccine, and other folks are going to need more encouragement.
Right. So, and I think that's the biggest hurdle that we're going to have. So this vaccine appears to be quite safe. We have not cut any corners. The big difference here is that typically when you submit something to the FDA, it might take months for them to get back to you about it. And now they've dropped everything else, and they're answering questions and looking at data about coronavirus vaccines immediately. So we've been able to speed up the process quite a bit. We're seeing a rollout in the UK already, and so we'll get even more data about a larger population being vaccinated there. If we want to return to any sense of normalcy, we need to get the vaccine. And we can't rely on herd immunity. Herd immunity requires about 70% of the population to get vaccinated for the other 30% to be protected. Some people can't get the vaccine because of underlying issues, so they can't be part of that 70%. We all have to do our part. And also, nothing has changed from a public health standpoint. We need to keep wearing our masks. We need to keep social distancing. We need to keep hand washing and staying home if we're sick. Otherwise, things will continue to get worse.
Listen, when it comes to the vaccine, too, I heard you say earlier this week there's some practical considerations to take into consideration, such as some people will have very minimal reaction to the vaccine. Others might be sick for a couple of days, and employers need to sort of make a plan for that.
Exactly, and we've had about 75,000 people who have been vaccinated already. So we have some good data, and most of the reactions are fairly minor. But employers do need to be prepared that you might have an employee who's out for a couple of days because they have a more severe reaction.
And before I let you go, do we know yet how long this vaccine is good for?
No, we don't. That's one of the scary things, too. We don't know how long protection lasts. And the really scary thing to me is we have no data about efficacy in children. We're just starting to look at kids down to the age of 12, but that's a big proportion of the population that we cannot vaccinate yet, and probably won't be able to vaccinate for 6 to 8 months, something like that. So there's still a lot of unknowns, but the data we do have is incredibly promising and predicts great success and predicts a lot of safety for people who do take the vaccine.
All right, Dr. Thompson, thanks so much for sharing your time with us this morning.
My pleasure. Thank you for having me.
You're very welcome, and take care and be safe. That's right. Stay with us.